This is Right to Life Radio. And now, here's your host, John Gerardi.
Well, it's actually a decent week for the pro-life cause here in California, as a couple of the worst bills that had been introduced in the state legislature this year were actually astonishingly vetoed by Governor Newsom. And here to break it all down with us is California Family Council's own Mr. Jonathan Keller.
That's me.
Good to have you, Jonathan.
Great to be here. We are both, well, no, you took off your hat. I was going to say, we were both rocking hats. I don't know why you were, but I didn't take a shower this morning, just being totally honest, ripping off the mask.
Well, I realized I had a Notre Dame hat and a nearly identical Notre Dame shirt, and I thought this is a lot of Notre Dame paraphernalia for one.
I mean, it's
YouTube
a big week. It's rivalry week, as they say.
Yeah, I'm not for those of you watching on News Channel 8 / our YouTube channel. Here's my Notre Dame hat that I'm not wearing.
That's right.
Notre Dame's playing USC this week, and I'm not looking forward to this game.
I think you guys are technically favored to win, though.
Like I mean, we're at home.
65-35.
I don't know. We're at home, but
my father-in-law is not looking forward to it either. I'll just say he's the biggest SC fan I know. Yeah. He is very nervous. Both, I'll just say, because I know, John, this is why everyone comes to Right to Life Radio through the sports talk. But I'll just say he's both nervous because, number one, it's on the road.
Yes.
Number two,
because USC could not stop like St. Mary's School for the Blind if they had a football team.
I mean, it was
their defense is that bad.
It was Arizona at home the other day, and it took them to triple overtime to beat Arizona, especially also because apparently their kicker can't kick a field goal from the 15-yard line.
Also bad. Bad.
But on top of that, the fact that you guys, Kentucky just lost, Notre Dame just lost to Louisville, which Louisville looked pretty good, I will say. I was fairly impressed. But the fact that they just lost means that I think Notre Dame's going to be, ready for revenge.
Well, Notre Dame's lost 2 weeks in a row, so maybe we're just bad, and that's why we lose. So that could also be it. All right. Okay, but let's get to the matter at hand here. So there were a couple of really bad bills that Jonathan and I, had been kind of tracking throughout the year, and we were kind of nervous about. And I'm going to start by talking about AB 576. Now, back in late September, Governor Newsom had a big, splashy press conference. He went on ahead and signed a whole bunch of pro-abortion bills and a whole bunch of bad bills that do a whole bunch of really bad things. And there were a couple of abortion-related bills, though, that he did not sign at that time. And you and I, Jonathan, noted this, and we were a little suspicious and questioning, well, why did that happen? Why did it happen that he did not sign these bills? And it turned out because he intended to veto them. And we were really some of these were, I thought, some of the most threatening bills that were coming at us, through the California legislature. So let's go over them. I want to start with AB 576. Now, AB 576 had to do with the abortion pill. And this is kind of a victory, but I'm also not sure if it's kind of a loss. So,
yeah, John, I just want to say before you start talking about this one specifically, I think this is something important as a big picture. A lot of times you see these flashy headlines. Oh, my goodness, especially this year. Oh, my goodness, Governor Newsom vetoed XYZ bill, dramatically showing his moderate streak. He's breaking from the radical wing of his party.
Yeah.
But if you go and read the fine print, in almost every case, whenever he vetoes a bill, sometimes when he signs them, but especially when he vetoes them, he very often will issue a veto message.
Right.
He'll have a letter that goes with it.
Yeah. And the letter is very important, especially it is for 576. So,
a lot of times, basically, the letter either softens or completely undermines the actual veto itself.
Exactly. So AB 576 had to do with the abortion pill. So just, repeated things help. The abortion pill is not the morning after pill. The abortion pill is a series of drugs that are taken up to 10 weeks into a pregnancy to induce a miscarriage. And the chief drug, the actual abortion pill proper, if you will, is called mifepristone. In California, the abortion pill is basically like it is throughout the country, in most places in the country where abortion is illegal. The abortion pill is accessible in a variety of ways, but it's governed by its FDA guidelines, and the FDA has certain health and safety restrictions around the abortion pill, and the on-label usage of the abortion pill is through the first 10 weeks of pregnancy. That is that's how you use the abortion pill, through the first 10 weeks of pregnancy. If a doctor prescribes the abortion pill beyond 10 weeks of pregnancy, that is an off-label prescription. And Medi-Cal, California's health insurance program, our state version of the federal Medicaid program, which provides health insurance for lower-income people, Medi-Cal has certain restrictions for whether they will reimburse medical providers, doctors, nurse practitioners, for off-label usages of drugs. Okay, so if you're using a drug in a really wacky off-label way that's far beyond what the FDA has allowed, Medi-Cal might not reimburse you for that because you're kind of going out on a limb a little bit. You're going a little wacky.
It's not an approved use.
Yeah, exactly. Now, it doesn't mean that you're doing it as illegal. It just means Medi-Cal might not reimburse you. AB 576 was basically going to say Medi-Cal is going to reimburse doctors for post 10-week prescriptions of the abortion pill. And just as with miscarriages, abortion pill because that's what the abortion pill is. It's more or less an attempt to artificially recreate a miscarriage. The abortion pill process is more dramatic. It involves more risk, more health risks, the later on into pregnancy you go. And the pro-abortion side is trying to push the legalization of the abortion pill and the approval of the abortion pill later and later and later into pregnancy. Why? Because it helps facilitate people's access to abortion. The abortion pill is about access. If you can get the abortion pill and you can get the abortion pill mailed to you and you can get a prescription for the abortion pill without having to physically go see a doctor through a telemedicine visit, it results in anyone in the United States with a P.O. box, anyone in the United States with an address that the post office reaches, being able to get the abortion pill, being able to get an abortion.
Right. And I will say again, John, this is very important because, I mean, obviously, a lot of this you have to consider not just what happens here in the state of California, but you have to think of how this is affecting things nationwide. And as you said, there are a lot of states in the rest of the country where their only quote unquote accessible mode of abortion is the abortion pill.
Right. Exactly.
And remarkably,
because they have very few clinics, or the clinics are in very remote places, not accessible to a lot of the rest of the state.
And remarkably, in California, even though we think, I mean, we kind of have this vision of, oh man, there's an abortion clinic on every corner. And that is kind of the case in some of the larger cities, if it's Los Angeles or San Francisco or places like that. There are shockingly, based on statistics, there are a lot of parts of California that are rural and remote that do not actually have surgical abortion clinics.
There's no abortion clinic in Visalia.
Yep.
For example.
There's no...
Much to Planned Parenthood's chagrin and in spite of their best efforts, there's no abortion clinic in Visalia.
No surgical abortion clinic between Fresno and Bakersfield. No surgical abortion clinic, I think, John, at least between Fresno and Modesto. Mm-hmm. I'm pretty sure.
Yeah. Well, Madera has a Planned Parenthood clinic.
Oh, okay.
Yeah. So with AB 576, the idea was let's get rid of this 10-week time limitation and allow Medi-Cal to reimburse, because that was the one big limitation on doctors prescribing the abortion pill beyond 10 weeks was the fact that insurance won't reimburse you for it. Now, if Medi-Cal starts to reimburse you for it, that's going to lead to a whole bunch of doctors and a whole bunch of Planned Parenthood clinics, because they accept a ton of Medi-Cal patients, getting abortions. Now, Governor Newsom vetoed this idea. But
Huzzah! He must be becoming pro-life.
Well, so as Jonathan mentioned, this is what Governor Newsom said in his veto statement. which was issued last week on October 7th. I'm returning Assembly Bill 576 without my signature. The bill would require the Department of Health Care Services to update Medi-Cal coverage for medication abortion to align with evidence-based clinical guidelines by March 1st, 2024. The bill is well-intentioned, but unnecessary. In July 2023, the DHCS updated the Department of Health Care Services updated its medication abortion policies for Medi-Cal to reflect current evidence-based clinical guidelines to reimburse providers for care through 77 gestational days. 11 weeks, not 10 weeks. 77 days is 11 weeks, not 10 weeks. This aligns with the goal of AB 576 and the priority of this administration to ensure that abortion care is safe, legal, and accessible. For this reason, I cannot sign this bill. So what Governor Newsom is saying is, I already made this change. I'm already allowing the abortion pill to be prescribed and reimbursed for through Medi-Cal beyond 10 weeks. Now, it's only through 11 weeks, but he's basically helping this along. So when we talk about this, I'm going to take this to heart now. When I talk about the abortion pill with people, I usually talk about it within the context of 10 weeks, 10 weeks, 10 weeks. Well, Governor Newsom's apparently made this change. He made this change in July, and golly, you and I completely missed it. Made this change in July that he's basically saying for Medi-Cal, you can prescribe the abortion pill 11 weeks into pregnancy, not 10 weeks, and you can get reimbursed for it. And that's the big limitation on the abortion pill is whether or not you can get reimbursed for it. And if Medi-Cal is going to keep reimbursing past 10 weeks, to heck with patient safety here. What we're focused on is money and abortion access.
We're just talking about Medi-Cal, John. That only applies to, checks Google. 40% of the state's population, or 15 million Californians.
Right. And a very disproportionate percentage of all abortions, I'm sure, just given the numbers of looking at socioeconomic brackets of the people who get abortions, it's probably overwhelmingly Medi-Cal beneficiaries, and Planned Parenthood's patient population specifically is probably overwhelmingly Medi-Cal beneficiaries. So it's kind of a victory, but not really. It's kind of a victory only because Gavin Newsom just thought at this point it wasn't really all that necessary. So this is a really not a very satisfying thing because this is how committed they are. They are so committed to abortion being accessible that they're willing to compromise the safety angle. When we return, I want to talk about this a little more, just to talk about a little bit about the economics of the abortion pill and Medi-Cal and clinic operations and things like that, and share a little bit about my background in Obria and how I came to understand a little bit more about this. That's next on Right to Life Radio. Back with Right to Life Radio, we are discussing Governor Newsom's vetoing of AB 576. Right now, we're in this point in the legislative calendar, so the California legislature meets from about January through mid-September during non-election years like this one. And then after mid-September, they have to pass all the bills that they're going to pass for the year. The state assembly and the state senate, they have to pass all the legislation for that year. This year, the deadline was Friday, December 15th. From that point, Governor Newsom then has a month. He had from September 15th until September 14th to sign or veto all the bills that he's going to sign or veto for the year. And he vetoed AB 576. AB 576, bad abortion bill, would allow providers, doctors, nurse practitioners, et cetera, to be reimbursed through Medi-Cal for prescribing the abortion pill after the FDA guideline 10-week time frame into pregnancy. Governor Newsom vetoes this. Hooray, we're all happy. But then we learn it's because he already made a regulatory change allowing providers to be reimbursed for the abortion pill through 11 weeks into pregnancy. So it's not the abortion pill being approved for 10 weeks through pregnancy. It's 11 weeks through pregnancy. He's pushing the envelope even farther than it's already being pushed on the national level. And, yes, you can prescribe medications off-label, but that was a big limitation on prescribing the abortion pill later and later into pregnancy was you might not get reimbursed by Medi-Cal for doing it. And especially with Planned Parenthood, a huge percentage of their patient population is Medi-Cal. A huge percentage of people who get abortions are on Medi-Cal. 40% of Californians are on Medi-Cal. Now, this leads me to want to talk about the economics of a Planned Parenthood clinic. And gosh, I'd love to get Abby Johnson's probably too difficult to get. But there's a couple of other like former Planned Parenthood like clinic managers and stuff like that I'd love to see if we can get someone like that on the show. Mm-hmm. Producer Colton, that's your assignment.
That's right.
I'm bellowing out my assignments.
Go find.
All right, go find somebody. Anyway, but one of the things, I mean, I learned in getting our Obria clinic started a little bit about insurance and what reimburses well and what doesn't reimburse well and what kind of reimbursement you get for a normal pregnancy and the difficulties of billing to Medi-Cal. And it's very difficult to run a nonprofit OBGYN clinic that's primarily Medi-Cal patients. It's why more and more doctors are deciding we're not going to take any Medi-Cal patients for OBGYN care because it's a financial loser. Unless you can get things set up just right, you're going to lose money. And that's where I can sort of see, especially I did this little task where I looked up the Medi-Cal reimbursement rates for various kinds of abortions and kind of the global bill for the abortion pill, what Planned Parenthood makes off of the abortion pill is quite a bit of money. And I think that is such a core thing to the abortion fight is beneath this facade on the pro-abortion side of, we're here in this about, women's autonomy and we're fighting for women's autonomy. We're fighting for reproductive freedom. We're fighting for equality for women. You scratch that surface a little bit and you find people and organizations making a whole bunch of money.
Yep.
And even like to look at, the services Planned Parenthood provides, they get $400 a pop for each first trimester surgical abortion. They get additional California state funding to get them to that $400 level. That's in comparison with, I was trying to think like what would be other than abortion, what's like the next most expensive thing that a Planned Parenthood clinic would do. And I thought maybe, inserting an IUD. Now IUDs are pretty much abortifacient, so maybe I shouldn't put them in a separate category. But just for the monetary comparison, the Medi-Cal reimbursement rate for an IUD is at $182. The Medi-Cal reimbursement rate for a first trimester abortion is $400. So abortion is clearly the big moneymaker. And when you look at the global bill for the abortion pill, so that means prescribing the abortion pill, the drug, and the procedures before visits before and after, they're getting it's over $500 they're getting just for an abortion pill abortion.
Wow.
That's global with, stuff before, stuff after. And this is the big thing. With the abortion pill, you don't have to pay a doctor for the whole time. I mean, you don't have to pay.
It can be telemedicine.
As much. You can do it via telemedicine.
They don't have to be physically present to actually perform the abortion.
Exactly. And so much of the cost of prenatal care, frankly, is tied up with you have to pay a doctor. You got to pay a doctor for their time. You got to pay they have to sit with someone, talk with someone, and a prenatal visit. There's not much to bill for. You're sitting, you're talking. Maybe there's something you can bill for, some procedure, something you can bill for, but you're just listening to this gal talk, and there's nothing to bill for. And God forbid she has a lot of questions or is upset about something, or then you got to spend more time with her that you can't bill for. And that's, I think, why, I know this is a bit of a tangent, but the economics of Planned Parenthood of abortion clinics, they try to trumpet so much. Oh, we do so much stuff. We're doing cancer screenings and woman exams, and
we're the provider of last resort for so many low-income women.
We're doing all these wonderful things. None of that stuff matters. for their bottom line. The cornerstone of everything a Planned Parenthood is doing. Just look at the Medi-Cal reimbursement rates for the different kinds of, and it's publicly available. You can download a big, fat, huge spreadsheet with all the codes for looking up, comparing the codes with what Medi-Cal will reimburse.
So abortion is essentially, whether it is surgical or pill abortion, chemical abortion, that is the real cash cow.
It's 100%. There's nothing else they do that's going to reimburse as well as abortions. Absolutely nothing. It is the obvious financial bedrock for everything the clinic's doing. And it's at the root of their philanthropic support. It's at the root of their government, the drive we have to do something. We have to fund Planned Parenthood. If Planned Parenthood weren't doing abortions, their donations would shrivel up. If Planned Parenthood didn't do abortions, it would eliminate the most revenue generative service they do. And to allow Medi-Cal to reimburse for the abortion pill beyond the FDA-approved guidelines, they're going to try and paint this as, what a victory for women's ability to access reproductive care. No, it's not. It's yet another boon financially for Planned Parenthood. It's yet another boon financially for abortion providers who just want that quick, easy cha-ching from another abortion pill prescription. Another provision of abortion where you don't have to provide very good care to this person and you get a nice, quick, fat reimbursement. That is the core of this. I think is money. There are people, you scratch the pro-abortion movement and you see people making money. It's just plain and simple as that. All right, we're going to talk about the health insurance market, the ways in which California law has been manipulating the health insurance market, and I think a good veto, maybe a slightly better veto by Gavin Newsom of a bill that would have had a bad impact on the insurance market when it comes to abortion. We'll dig into that next on Right to Life Radio. Back with Right to Life Radio, and we're going to talk a little bit about the insurance. This is going to sound boring, but I guarantee you it's not, because I think it's a fascinating way in which California, as this pro-abortion nightmare state, is using the health insurance market to manipulate things in order to make abortion more prominent, to have more abortions happen, make abortion more accessible, as is constantly said. Now, the thing we were sort of monitoring throughout the course of this year, one of the bills we were monitoring was AB 1432. AB 1432 was going to create a new abortion mandate for group health insurance plans. And basically, we need to kind of understand the broader picture of what's going on in California with health insurance plans and how California has, for almost like 10 years now, been mandating abortion coverage. So back in 2014, Planned Parenthood started getting really ticked off. They were getting ticked off at a bunch of Catholic universities in California. I think it was
Ricardo Lara.
Ricardo Lara was ticked off about it. He was, at that time, a very influential California state senator.
Yep.
He went on to become he is currently the California State Insurance Commissioner.
Yep.
Which is a statewide elected office. And Planned Parenthood was getting real ticked off at Loyola Marymount and I think a couple of other Catholic universities around the state. Why? Because their health insurance plan, their employer-based health insurance plan, did not include coverage for abortion. And so what did they do? The California Department of Managed Healthcare wrote a series of letters. They didn't pass a law that was signed by that passed by the Assembly and the Senate, signed by the governor. They didn't issue, a ballot initiative that we all voted on. They didn't even issue like a normal regulation. They just sent a bunch of letters. And they sent a bunch of letters to
Dear colleague letters.
Dear colleague letters. And it was a bunch of letters to all like the major health insurance companies throughout California. And they said, basically, state law requires all of you health insurance companies, you all have to cover essential healthcare services. And basically what we're doing is saying that abortion is an essential healthcare service. Just, wave of a wand, snap of a finger.
Bada bing, bada boom.
Bada bing. Abortion's a necessary healthcare service. So you guys were not covering elective abortions. That's how you phrased it. Well, there's no such thing as an elective abortion. No abortion is elective. All abortions are necessary, essential healthcare. So you all need to stop having health insurance plans with an exception allowing for different people to get, policies that don't include abortion coverage because it's essential healthcare and you have to cover that per California law. Boom, overnight, every health insurance plan in California had to cover abortion. The only exception to this was with group, sort of self-insured entities. So if you were a self-insuring employer, you didn't have to provide abortion coverage. And this year, a bill was introduced that would basically try to close that final loophole. So AB 1432 would require group health insurance policies in California to cover abortion, abortion-related services, and transitioning drugs and sex change surgeries. Now, this would have been pretty darn bad. This would have basically eliminated any health insurance plan in the state from being able not to cover abortion, including self-insuring entities. The governor vetoed this bill. And he said this bill would require any out-of-state health insurance plan regulated by the California Department of Insurance that is marketed, issued, or delivered to a California resident to provide coverage of abortion, blah, 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 blah. I commend the author for working to provide additional assurances that California residents can access abortion services and gender-affirming care. It's a priority of my administration to ensure that abortion and gender-affirming care are safe, legal, and accessible. However, it is not evident that out-of-state health insurance plans serving Californians do not already cover this care. Further, though well-intentioned, this bill could invite litigation where an adverse ruling would outweigh a potential benefit.
That's the real line.
That's
the real line.
Yeah, and that's the line. So what's Governor Newsom afraid of here? Governor Newsom knows that the Supreme Court is pretty stacked at this point in favor of affirming religious liberty complaints. Okay, the people who are saying, hey, this is infringing on my free exercise of religion. He knows that the Ninth Circuit Court of Appeals is not nearly as friendly to any liberal policy that comes down the pike from the California legislature as it was, 7 years ago.
Pre-President Trump.
Pre-Trump. So basically what he wants to avoid is forcing another religious employer, another group of religious employers, or people who ethically are opposed to abortion. He doesn't want to force them to provide abortion coverage, like, for example, a Roman Catholic diocese. So a given Roman Catholic diocese might employ, I don't know, how many people do you think the Archdiocese of Los Angeles employs, Jonathan? I mean, probably thousands of people. Yeah. He doesn't want Archbishop Gomez to sue him and say, you are infringing on the Archdiocese of Los Angeles, which has however many gazillions of churches and gazillions of school employees and whatever. You are infringing on our right to free exercise of religion by forcing us to cover abortion services in our employer base, in our self-insured, health insurance plan here. He doesn't want to face that kind of litigation because he knows there's a very distinct chance he could lose in the Ninth Circuit and a more distincter chance that he could lose at the U.S. Supreme Court. So it is kind of, I got to say, Jonathan, it's kind of funny to me how almost regardless of how Looney Tune pro-choice California governors get, there's a certain point in which they have to kind of be the adult in the room. And, Governor Governor Brown did this, where there were several really bad abortion bills that he vetoed in his last few years in office because he found there was some other reason that didn't have anything to do with abortion, where he was like, yeah, this, we can't have abortion pills being distributed at CSU and UC health centers. They're not equipped for providing the abortion. This is kind of beyond the scope of what a student health center is supposed to do. I love legal abortion. This is what Governor Brown would say, not what I would say. Governor Brown loved legal abortion, but he was like, this is not the role of a CSU or a UC student health center. Like, this is ridiculous. Now, Gavin Newsom did not have that restraint. And I've always thought that was maybe one of the worst aspects of the Newsom governorship, has been that he's been more extremely pro-choice. I think it's fair to say he's been far more pro-choice than Jerry Brown.
No doubt.
Yeah.
And the one thing that I will say is somewhat similar was that there was a bill.
In spite of Jerry Brown legalizing assisted suicide, which was a major bad breakthrough.
Yes.
I would still say Gavin Newsom's worse.
Well, yes.
And I think Newsom would have legalized assisted suicide with less hemming and hawing than even Jerry Brown had.
It wouldn't have taken the
years.
Yeah. And I also think, John, it's interesting, though. This is maybe the closest that he's come to channeling his inner Jerry Brown. Because if you remember, there was a bill back in, I think it was 2015 or 2016. I don't remember. It was either 2015, 16, or 17. It was one of those times. Maybe it was even 2017, because I think it was after you were working with us at CFC. It was a bill that basically, from Lorena Gonzalez, SB 742, that would have mandated abortion. They were calling it the Pregnancy Non-Discrimination Act.
Yeah. So basically, if you were a church and you had an employee,
religious school,
or religious school, or
pregnancy
something,
center, right to life.
You had an employee who had an abortion, that you could not take any kind of adverse employment action with regards to that person, even if what they're doing is fundamentally contrary to sort of the mission of what your organization believes.
Yeah. And Jerry Brown vetoed that, remarkably.
Yes, he did.
And in some senses, I mean,
I think that was AB 567.
Okay. Yeah, that sounds more right.
Yeah.
What was 740? I can't remember. I did remember 742, but now I'm gonna have it.
Well, it's every year they can have the same numbers.
I know.
Anyway.
So there was basically, though, there's multiple versions of this and different things that I think Newsom, though, as you said, John, is realizing that at a certain point you kind of either have to put the brakes on because of financial issues, which is the reason that he gave before, or you have to look at this and say, look, guys, this is going to be counterproductive, because if we get a bad judgment against us at the Supreme Court, either at the Ninth Circuit or at the Supreme Court, this is going to mean that the latter state is going to be worse than where we are right now.
Right. And so it's smart. It's smart on Newsom's part. He and it is even a thing of like, there are other bills, which we're not going to get into. Okay, so one of the bills that Governor Newsom vetoed, that the social liberals in the state legislature were pushing, was SB 541. All right. So SB 541 was this whole bill about making free condoms available to kids everywhere in every, school throughout the Golden State, and supported by every Democrat in the legislature. And Governor Newsom vetoed it. And in his veto message, he mentions basically that this program is like a completely unfunded liability that should have been brought up during the budgetary discussions, and you didn't bring it up then. So we're going to have a $30 billion budget shortfall, so I have to veto this. And it's so amazing to me how our state, I get into this on Right to Life Radio because I think it's relevant to understanding how the state legislature in California works. The state legislature has fiscal committees, the appropriations committees in the Assembly and the Senate, and they review every bill that spends money. And they don't do their job. They just rubber stamp stuff because it's basically an expression of the Democrat majority saying we like this or we don't. And there's really very little, I think, serious fiscal analysis that goes on, oddly enough, in the appropriations committees, in the fiscal committees. And so the governor basically has to act as this like fiscal backstop for these bills that present these completely unfunded liabilities on the state government. And it winds up sometimes working to the advantage of pro-lifers that the state, and I say this just to emphasize, our state legislature is so wildly pro-abortion that even the basic realities of, hey, we're going to have a $30 billion budget shortfall. This measure is not even, we didn't even approve this in the state budget. They'll still vote for it. They don't care. These people are so in the pocket of the abortion industry. They will just vote for absolutely positively anything. All right, we'll be back with our closing thoughts here on Right to Life Radio right after this. As we close out Right to Life Radio, I want to talk just real quickly about issue 1 in Ohio. That's the name of it, right, Jonathan?
I believe
issue
so.
1. Okay. So I want to bring everyone's attention to this. This November, early November, Ohio is having a really, I think, nationally important statewide ballot initiative Tuesday, November 7th, regarding abortion.
One of the most important in the country in recent history.
Yeah. And basically, this is a ballot initiative called Issue 1. Now, Ohio passed back in 2018 a heartbeat bill. This was a bill to ban abortion after fetal heartbeat could be detected. This was passed in 2018, and the law came into effect after Roe v. Wade was overturned. So Ohio has had very restrictive anti-abortion laws on the books since then. Pro-choicers in Ohio managed to qualify for the ballot. This is an amendment to the Ohio state constitution. So the Constitution of Ohio would be altered by this to include a very broad right to abortion. So if it's in the Ohio Constitution, what it means is the Ohio legislature can't change it through a normal law. Okay, you need another amendment. And this would put a pretty broad right to abortion into the Ohio Constitution. So this is potentially really bad, that Ohio could be legalizing abortion pretty broadly, and we could see a massive loss, a pro-life state. And look, Ohio has shifted, I don't want to equate Republican with pro-life, and unfortunately, this election might be the thing that demonstrates that Republican does not necessarily equal pro-life.
Yeah.
But Ohio has shifted very much in a red Republican conservative direction over the last several election cycles. I mean, it was one of the key battleground states for George W. Bush, and Donald Trump won Ohio very comfortably both times. Republicans won various statewide offices in Ohio very easily in 2022. And I think my fear is that there is a not insignificant percentage of Republicans throughout this country who are basically like, well, I think some kind of right to abortion is okay. And if you draft some kind of guaranteeing right to abortion ballot initiative broadly enough, these Republicans are dumb enough to vote for it. And or misguided enough to vote for it. And they don't see that a vaguely worded right to abortion means a very broad right to abortion that will likely include a right to abortion even beyond viability for spurious so-called medical reasons. So I would urge all of you, pray for the pro-lifers in Ohio, maybe donate to a No on Issue 1 campaign.
I will tell you, John, my counterpart there, the Center for Christian Virtue, ccv.org. Great place to donate if you're looking to do stuff there.
Absolutely. All right, that'll do it for Right to Life Radio. See you next time on Power Talk.